in a beautiful way. And she's able to speak to the studies that are out there and corroborate or deny or whatever, that kind of thing. Um,
That was when we're recording now, and that was Wendy's intro, catching Mary up to where we are reading Rani Bora's story on mood disorders, a conversation with Dr. Rani Bora.
mhm.
And I'm suggesting we don't have to back up that far
No,
because the recording, but we could back up by one paragraph.
if
With
someone believes, start with if someone believes.
exactly.
Someone
Yeah.
believes, if
Yeah.
someone believes.
Yep, at the near the top of the page. Want me to start?
Sure,
Yes,
go ahead.
please.
Okay. So this is Rani Bora speaking, the physician. If someone believes in the chemical imbalance myth and thinks they
Okay.
need to carry on taking the antidepressant for the rest of their life in order to function well, they will need to carry on taking it. If someone believes the medication has helped them, but they don't need it anymore, they will try to come off it as long as they get help from someone who knows how to de-prescribe safely. They may be able to come off it safely. Also, another thing that is very important, people often say, quote, I was not sure the medication was doing anything, but I tried to come off it and I felt worse, so it was working. And Hannah says, yes, I hear that a lot. Ronnie, I try to explain to them this doesn't necessarily mean it was working. It's quite likely that they could have been experiencing withdrawal symptoms from coming off the medication. So they went back on it out of fear and innocently misunderstanding what was happening, felt better, and concluded that the medication was surely doing something to help. I can't tell you how many times I hear this. Different people have different experiences, and although we can't say for sure why that is the case, though it does play a role, thought does play a role. Please note, you should never try to stop any psychiatric medications abruptly. Always discuss with your doctor, do your own research, and only gradually taper off with expert medical supervision or guidance. Here's a pregnant pause. This Friday, I don't know if Lori's going to go, but this Friday there's a big conference that Rani Bora put on LinkedIn, and she and other doctors are going to be talking about de-prescribing because people are going in that direction of saying all these medications for mental health issues we need to pull back. There's a lot more of a natural. So there's a whole conference set up live on Friday, I think at 2 in the afternoon, on de-prescribing, and I think it's international. So I'm going to be going to that. It was free, but so if you
Oh,
Beautiful. Will you send
Elaine,
me the link by text? Because I'd like to send it to a local psychiatrist.
yeah, I thought you already had it. You signed up for it. You told me you signed up for it.
Well, it's not in my book, so
Oh,
I don't
maybe.
think that was me.
Oh, that no, that was Hannah that said she signed up for it. Hannah. So I will get you the link to both you and Elaine and Mary if you'd like to
yes.
go too. You can get the link too. You're on mute, Mary, but
I'll
yeah,
take the link if you're
yeah,
sending it,
yeah,
Wendy.
yeah, de-prescribing. Yep. Okay, you got it, guys. All right.
You want to
So
keep
always,
going or
yeah,
somebody else?
I'm happy
You
to go.
want okay.
Always discuss with your doctor, do your own research, and only gradually taper off with expert medical supervision or guidance. Hannah, you bring up a good point because as a coach, I've helped a lot of people who are ready to come off of medications. I always insist they have professional medical supervision as I'm not a doctor, but they often need more support, someone to hold their hand day by day, as it can be a bit bumpy, especially every time they step down. I know people who have come off too quickly on their own, had some very bad withdrawal experiences, and then the doctors told them, see, you're worse than ever. We have to put you back on more medication. But really, it was the side effects of the detox that they were actually experiencing. Ronnie, yes, we call it withdrawal effects. Hannah, you mentioned earlier a mind at peace will not experience mental health symptoms. A disturbed, busy mind will experience symptoms of mental ill health. End quote. I'm going to say that quote again. Quote, a mind at peace will not experience mental health symptoms. A disturbed, busy mind will experience symptoms of mental ill health, end quote. Can we look at that a little deeper, Dr. Bora? Do you see a relationship between someone who has a profound insight and an understanding of well-being and the amount or severity of their withdrawal symptoms? In several of the stories in this book, people have come off medications with minimal side effects, but I hear of others really suffering. All right, pass the baton.
I know for a fact that severe and prolonged withdrawal symptoms do occur, and it is very unfortunate that these lead people with disabilities that the medical profession does not fully recognize or doesn't fully know how to treat. The longer people have been on medication and the higher the dose, the higher the risk of severe withdrawal symptoms. People who have profound insight and understanding of their well-being certainly will have an advantage over people who do not have any understanding or only have an intellectual understanding for sure. I have heard stories of how people found the withdrawal symptoms relatively easier to bear with their understanding of the three principles. This has helped them detach from stories of what the symptoms mean and not add more layers of thinking, which makes things worse. They are also able to listen to their wisdom and explore tapering plans with their doctor or therapist and look at ways to nurture their mind, body, and spirit even during challenging times. I don't think it will always be a smooth ride given the nature of the withdrawal symptoms and the impact on physical body and the psychological mind. However, understanding the principles can help ride the wave of calm during turbulent times and give people hope from the inside out. Anna, thank you. That gives so much hope. Understanding how things work always makes it easier. Have you got any advice for people who are withdrawing? RB. So some patients seem to think that they are doing it very slowly. But if you ask them how slow it was, it's not exactly what I suggest or what the current evidence is saying. They might just be going according to the next tablet or capsule dose available. This whole process is called linear tapering, and many will experience withdrawal symptoms, especially if they have been on the medication for several months or years. The last bit of tapering can be the worst, and so it's very important not to skip these low doses. It might be tempting, but the brain needs time to adjust. We also know now that the withdrawal symptoms in some cases might not appear for a few weeks after stopping. Some may have what we call protracted withdrawal symptoms. If a patient or doctor doesn't know this, then they may be misdiagnosed as having a relapse of their mental health disorder rather than withdrawal effects arising because they have reduced their medication too quickly. Anna, wow, that is really important thing to know for anyone coming off medications. Knowing that you have innate well-being underneath all of this can make such a difference in this process. So you are saying that withdrawal symptoms can appear even a month or more after stopping. RB, yes. Protracted withdrawal symptoms are more common than we think. What's really important to know is people will start to feel worse as the dose drops smaller and smaller. So they need to be very cautious with the last few dose reduction. Anna, this is why as a coach, I always ask for the schedules of dosage drops so that we both know what is happening and when. Pointing them back to their innate health and resilience can make all the difference in those days of discomfort and confusion. Can you explain the issue with those last few drop downs for us and why we need to be so careful? RB, yes. When we start someone on medication, we do a step-by-step approach. If you think of steps going upwards, people are climbing up the steps, going from one to the next. When the medication was introduced, the brain had to maintain homeostasis of the body and to adjust to the medication. When the medication is reduced and stopped again, the brain needs time to adjust to this. Instead of tapering linearly, the available research suggests hyperbolic tapering, meaning tapering according to the receptor occupancy of the drug. Anna, so the lower the dose gets, they have to be more careful. RB, yes, if people struggle to come off a smaller dose, they need to discuss with their doctor about switching to a liquid preparation or tapering strips. Hannah, this is what full consent really means. Getting all the information even before starting a medication. So many people I have met who are suffering are not told any of this. Can you talk about the differences between withdrawal and relapse? RB, yes. If it's withdrawal, people can experience both psychological and physical symptoms. flu-like symptoms, electric shock sensations like brain zaps or shooting pains, headache or irritability, insomnia, anxiety, low mood, and mood swings. There is a
Sounds like
long list.
mental health problems to me.
Absolutely. So there is a long list of withdrawal symptoms people can experience. If it's a relapse of the original diagnosis, it won't be accompanied by somatic symptoms that were not present during the initial presentation. The symptoms would be more or less like the original psychological initial presentation. The symptoms would be psychological symptoms. People might have taken an antidepressant because they were stressed at work, or they were feeling overwhelmed, or they were diagnosed with depression, and the doctors prescribed the medication, and then they decided to stop. Now they are not only feeling low, they also feel anxious and experience physiological symptoms that they had not experienced before. Hannah, so you were saying that if there are physical symptoms that weren't there before, then that's withdrawal symptoms and not a relapse. RB, very likely. Plus, if the doctor starts them back to the medication and immediately, like within a few days, they start feeling better, it's very likely to be withdrawal symptoms, not a relapse. I hope people understand that there is a difference. Anna, thank you. I think it's really important to highlight this as people are sadly ignorant about this, not through any fault of their own, but they just haven't been given the right or enough information and continue to suffer unnecessarily. RB, yes, if someone has a diagnosis of recurrent depression, for example, they are rarely on one antidepressant. Most of the time, they are on 2 or 3 psychotropic medications. And what I'm also seeing is physical health comorbidity. In my previous role as a community consultant psychiatrist, I often encountered people with multiple medications for their mental health as well as for their other physical health symptoms. One patient was taking 18 different medications a day. Can you imagine how that might feel? Everyone will agree that polypharmacy is not good, and yet it is not easy to take people off these medications. If I were to be very honest, I'd say that in the current mental health paradigm, despite using what we call evidence-based medication, most patients don't get better with more and more medication. Hannah, and that is heartbreaking to hear. I see it all the time in my coaching practice. Can you talk about how you came across the 3 principles and how this understanding has affected your practice as a psychiatrist? RB, I used to be an emotional freedom techniques advanced practitioner. Soon after becoming a qualified EFT trainer, I learned that my EFT trainer was leaving the world of EFT for something called the 3 principles. I was very intrigued. She was running a very successful EFT practitioners training business, and I didn't understand why she decided to leave it. So I came along to a couple of her meetup groups. I was very skeptical at first. It seemed to me as a combination of mindfulness and CBT. I finally agreed to have a 2-hour long session with her to explore this understanding. It was during the session that I had a strange and powerful breakthrough. It was more like a meltdown, an aberration. I experienced something like a dark cloud come out of the blue in my mind's eye, and I suddenly burst out crying. I cried and cried. Both of us were taken aback. The words that came out of my mouth were that I had always considered myself a very well-meaning, recovery-oriented psychiatrist. However, I was always trying to fix my patients, meaning I realized that I actually saw them as broken. That was the starting point for me. I started seeing something very differently. I began to see my patients differently. They were on various medications at the time, and quite poorly when I had that insight, but I was able to see beyond their symptoms of ill health. Over time, I have come to see more and more clearly that people may feel lost, and they may feel lost or be lost for a long time. They may feel damaged or broken, however, can never be broken. I am talking about the essence of who they truly are. This can never be broken. See, this has changed how I practice psychiatry and how I share a message of hope, true hope. This has become the foundation of my work. I'm going to pass.
Wow. Yeah, I'll take it from here, but I just want a little segue here. Woo! Just wonderful. You know, I never heard how Rani Bora got exposed to the three principles, her EFT training. I've heard so many stories like that. And yeah, just so many miracles. Okay. Hannah says, wow, I wish every psychiatrist could see that. Just imagine how it would change the way we help people who are feeling lost. Sid Banks said, there need only be one generic mental illness, an inability to see the role of thought. Can you talk about this and how it has helped your practice? R.B. Rani Bora says, I was working as an inpatient psychiatric rehab psychiatrist when I had my profound insight. So my patients, as you can imagine, all had severe mental health problems, mainly psychoses, but also many people with long-standing chronic depression as well as bipolar. What I saw was that they had health, innate health. Then I saw there was something in common between me, the psychiatrist sitting on the other side of the desk, and my patient, who had all kinds of problems. We are the same. We all have misunderstandings of where our feelings come from. It certainly looks as if my feelings are telling me about the world out there. It certainly doesn't look like I'm feeling the principle of thought taking form moment to moment. And when I am caught up in this misunderstanding, I can react. The misunderstanding of the role of thought and trying to analyze our thinking can take us to very dark places. At our core, we are all the same. All of us get tripped by the illusionary power of the mind, which makes it seem that thought has no role to play in our mental distress. We're all spiritual energy in disguise, as Sydney Banks once said. Disguised as human beings, we can forget the role of thought in creating our moment-to-moment experience. People are desperate to find an answer. People are suffering, but they are looking outside for the answer. It seems like something outside of them has the answer they are looking for, be it their past, other people, or circumstances. But the answer they are looking for is within, and something outside of them can't make them feel better or provide a lasting solution. Because of what I see very clearly now, and because my understanding of the three principles has deepened over the years, I now see what's missing in psychiatry. It is the spiritual connection. We talk about health in the healthcare sector. We talk about mental and physical health, and that there's really no separation between physical health and mental health. People agree that there is a connection. However, people don't seem to see the connection between physical, mental, and our spiritual life. Or to say it another way, the connection between mind, body, and spirit. And this is what I see is really missing in mental health care or in healthcare in general. Hannah says, yes, I've always thought that if the problem isn't out there, then trying to fix the outside isn't going to help. It has to be on the inside. It has to be spiritual. Oh, I love this. You want to go, Wendy? I'm just loving this. I can keep going if you.
No, can you share your
Oh.
screen? Can you share your screen with me? I have
Oh,
a,
you want me to give you co-host privileges? Is that what you're saying? Okay.
yeah, thanks.
Two. Wendy, make co-host. Yes.
Okay, because I want to offer Mary the chance to read. I have the book on Kindle. So, oops. So
Thank-
Mary, we left, if you're interested to read, we left off up here at RB, right? And this has never been taught in Western medicine.
Okay, thanks. Right, and this has never been taught in Western medicine. In some places, staff are required to fill out forms while carrying out psych assessments. I have seen the box for spirituality left out many times. And even when it is completed, there is usually a mention of whether the person has religious beliefs or if they were an atheist. In my opinion, this is where we are going wrong. People confuse the word spiritual to mean religion, and as mental health professionals, understandably, we don't preach any religion. But we don't have any training on understanding of spirituality or understanding of our true nature. We were taught that it is all very complex, but I love what Sydney Banks said. When the answer is complicated, it is the intellect. And when the answer is simple, it's the heart. I still remember a senior and highly respected mental health practitioner I used to work with. She would present all the cases for us in the meetings, and she would start with, like, this person is very complex. And then she'd tell us every reason why she considered them complex. And then she'd go to the next one and say, this person is also very complex. So every time we heard a complex story, and this is how we have been taught that mental health is very complicated. So it really feels quite hopeless because some people have been unwell for all these years and they have tried all these medications, all the psychological therapies, and we aren't trained to offer anything else that's not considered evidence-based. And it's very hard, heartbreaking. Both healthcare staff and the patients are struggling. So it's more like firefighting sometimes rather than really having an answer for people. Should I continue or stop there?
Yeah. No, it's fine. Keep going.
CS, after you changed your focus on how to help people, what was the reaction of your colleagues? What did they think about your insights and new ideas? I learned the hard way. Okay, RB, I learned the hard way. Initially, following my powerful insight and being impacted by the principles, I became almost evangelical. I put off some members of my team big time. I also landed in trouble for introducing the principles on the board I was working in. It was an important lesson to learn. Since then, I have not tried to convince my colleagues to explore the three principles unless they got curious and approached me. However, they all knew I was holistic in my approach and shared well-being, three principles, books, as well as had well-being conversations with my patients. I don't talk about the three principles as such. I share based on what would be most helpful for the patient sitting in front of me. As my understanding has deepened, I am able to practice psychiatry in a holistic way. My colleagues are aware of the good feedback I receive from my patients and that I take a patient-centered approach, but I don't preach about the principles. CS. Do you have a story you can share how somebody really shifted and saw something different? RB. So there are a few people that come to mind. One person had chronic depression. For several years, she was on several different medications. She had tried so many therapies, like conventional therapies, as well as equine therapy, etc., and nothing was working. When she first came, she wanted more medication changes, but I introduced her to the three principles. I didn't have much time in the clinic, and she just wanted to talk more about medications. I introduced her to Sid's books, and she did not get it. But then I invited her to come to a 6 weeks course I was running where I was pointing to this understanding. I remember her feedback was, when you first shared with me about the principles, I had a lot of resistance. And you gave me the books, but I never thought too much about it. But when she attended the course, something was different. She engaged well and was deeply moved by what she had learned. During the course, she had a very traumatic life event. And she said, I wouldn't have been able to handle this at all, let alone come to the course before I met you. She had such deep gratitude. It was so profound, so beautiful. So that was some years ago. More recently, I have lots of examples like that one. One lady, again, recurrent depression. She had a recent bereavement, and over the years, She's been put on all these medications. The first time she walked into my office, she told me how a very close family member had passed away. She was shaking. She was quite poorly in terms of mental health. I reviewed her medications, reduced the dose on one of them, and I did some psychoeducation around meds, lifestyle, and so on. But I also asked her to read The Second Chance. And then when I saw her after 3 months, she seemed to be a very different person. She was so much better. She had her nails manicured and she could make friends. And her friends said this is the best she has been in years. Before she was a nervous wreck, she was freaking out. It was such an amazing change. And then she said, "Oh, in the book, oh my goodness." Sydney Banks, said, when he talked about listening, I really got that. I could see that she was trying to articulate something that was hard to express. And she said, I can really listen now. I can really listen. I know that doesn't mean that all her problems have been solved, but she was beginning to get a sense of the intelligence behind life and how the mind works. CS, that is so inspiring and hopeful. RB, I know, right? I want people to know that coming across the three principles doesn't make everything wonderful and amazing. And now everyone is walking on cloud nine. It's like Sydney Banks said, life is a contact sport, but when we can handle it from a place of groundedness rather than panic, and we remember who we truly are and how the mind works, we can find peace and calm again. CS. Amazing. Thank you, Ronnie. Your experience is so valuable. Thank you for sharing.
Well, that's great. I gotta pipe in there. I found it tremendously interesting that Rani Bora's second patient there got better by her description from learning to listen.
Mm.
That was her
She,
insight. Yeah, it's so fascinating. If we, I was just thinking, if we could have a book of how and where people got insights, it's just so interesting how
well,
that.
but it's sort of it's so interesting as a nurse, whatever, I don't know, but to say I have this problem and I'm chronically depressed, my family member just died, I'm shaken, I'm a wreck. But when I listen to other people, everything smooths out. That's not a very obvious fix. Typically, if you have somebody that doesn't feel good, they're depressed, they're sad, they need they need to be listened to, or they need a medication, or they need a vacation in Bora Bora, or whatever, right? But what she said, what got her out of her mess was she began to listen deeply to other people. I find that fascinating.
Yeah, what occurred to me, the first thing that occurred to me was when you're listening only, your mind is more quiet, number one. But number two, if you're in such a state, your mind is not on yourself. So it does
Yeah.
those two things.
Yeah, but that is not the convention. But Mary and I have Mary and I, we have a lot in common in terms of our faith-based things. And we've been taught in Christianity, if you will, I'm sure a lot of people are taught this, serve other people and you will get better. And this is just like such a classic example of it, but it's not what's done in the world, or certainly in the world of mental health care. Mental health care is you poor broken thing. We'll do our best to help you and support you and give you crutches and whatever, but you don't have what it takes to take care of yourself. You're in a deficit model, and I don't know if you'll ever be filled up. Ooh, you poor thing. You're going to always need this medicine or these psychiatric visits or whatever. And I just find it really interesting that the ancient wisdom of how we are created, what we are here to do, we're here to serve. And right there it was. She said, I got better when I learned to listen. I'm like,
Mhm.
it's just, oh, yeah, love it.
It reminds me of, when they talk about after disasters, and especially after Hurricane Katrina, where they looked at that, they like analyzed what went on afterwards, and people were traumatized. And what helped them was helping others,
Yes.
not being treated for anything, but helping others.
Yeah.
Yes.
Yeah. Interesting. I've not heard about that study, but it makes sense. That's how we're built to be communal people, you know.
Mhm.
That's part of our makeup, and yeah, it comes from the inside out. Like I see you, I might not have bread, but you haven't had bread for one more day than me. My first piece of bread's going to go to you or whatever, right?
Mhm.
Yeah, it's fascinating.
And I
So,
can speak from personal experience with my mother, and her mental health issues. She spent years on multiple medications. She spent years in and out of, different kinds of mental health institutions. And she taught me how to listen, because nobody in all of those services and all of those medications really listened. And of all my siblings, I was the only one that she could talk to. And that's one of the reasons why I'm what I am, who I am, and why I serve people.
mm,
Yeah.
yeah.
That's how Elaine got into being a therapist, right? Yeah.
Yes.
I remember Elaine and I have talked about the fact that our mothers were both pretty compromised growing up, and my mother, she, I don't know, she's like a size 18, size 20 on occasion, whatever. I'm bigger than she was, but she carried a couple of extra pounds. When she was very, very, very depressed, she got very, very thin, and that was a sign that my father had to bring her to the hospital. That was their routine kind of thing. But she would say, if I stub my toe and it's big and purple and I go to the doctor, they're going to say, well, if you lost a few pounds, she goes, it doesn't matter what I talk about, what I'm concerned about, what I'm worried about. It's you need to lose weight. And she was like, I don't go bother going anymore. I don't, and I get so mad. It's such a misogynistic,
Yeah.
Mm.
yeah.
Yes.
And then
Yeah.
we have doctors like Jonathan Schwartzbaum, right? Joshua Schwartzbaum in New Jersey, who runs I think the three of you know about him. He runs an ER and a addictions unit. And he wrote a book. I'd love to know how he got introduced to the three principles. It was great hearing Randy's story. I never heard Randy's story. But anyway, Joshua wrote a book. I think the title, a couple of books. One is Listening for a Feeling.
Yeah.
And I think that's directed at young people. Like a lot of young people are taught to not, especially boys. Oh my goodness, you can't cry if you're a boy, right? But he's so open that the boy can cry, and then he knows how to just listening helps the boy with the broken arm or what have you. That was the illustration in his book of a broken arm that, making, because then you feel connected to your healthcare provider in not about crossing boundaries, just like I can trust him or her teaching me how to trust my innate health.
Mhm.
What a connection that creates. So, yeah, listening is
Yeah,
incredibly powerful. Wendy and I created an ebook about listening.
you did.
Mhm.
Yeah.
Yeah.
Did I ever
Yeah.
give you that, Mary? The ebook on deep listening? I wonder if I did. If I didn't, I'll get it to you. But
Yeah.
yeah. All right. Want me to carry on? I think this is the section of the book where Lori's story comes in.
But first, we have Linda Quiring. You want to read about Linda? Linda was, from my understanding, we'll find out if this is true. She was Sid's first
Yep.
student,
Yeah, that's what
and she's still alive today. Yeah,
yeah,
Linda Quiring. And she wrote a book, a few books.
yeah, yeah. about her experiences with Sid in those early days. Mary, you might like these. They're very, and she's not hanging around on webinars. She's not online. She's just living a quiet life up there in Salt Spring Island. She's a very interesting lady. All
Yeah.
right, I'll read. Linda Quiring, depression. Somehow in my mid-20s, I became deeply depressed. I had a wonderful husband, the cutest 3-year-old boy, and a beautiful home. I had a great job and drove to work each day in a new convertible, yet something was missing. It went on and on, so finally I asked my doctor for advice. He sent me to a psychologist, and after 3 months of therapy, she suggested I get a divorce. Now, even though I partied with friends and dated a lot, things weren't improving. Then I joined a quote awareness group at the local college. There was a lot of screaming and yelling, as in all those early 70s encounter groups. But I made a lot of new friends and I met Bill. He was going through a separation from his wife and had 2 small children, but we hit it off. After a few months, he got the brilliant idea that we should move to the country and, quote, go back to the land, end quote. This was a big thing then, and I agreed. Bill had heard of Salt Spring Island just off the coast of Vancouver and apparently filled with hippies and American draft dodgers. We visited this quaint place, 2,000 people in a very small town, but it was so beautiful. We looked at a small cabin in the forest with a creek running through. We'll take it. And that was that. We sold my home, quit my job, and moved to the island. But it was so boring. We knew nobody, and neither of us worked as we had money from the home sale. Each day I got Gary, now in grade 1, off to school and then sat around all day. I cooked, cleaned, did the laundry, and had a few things to keep me busy, but Bill had never not worked. After 2 months, he left to join a rock and roll band with a friend. I fell into such a deep depression, I again sought help. I visited my old doctor in the city who sent me to a psychiatrist, so famous in our area that he owned his own private hospital, the Hollywood. Yes, weird name. On my first visit, I was so filled with anxiety, he gave me a sedative, and under the influence, I voluntarily signed myself in with a diagnosis of extreme clinical depression and anxiety disorder. I agreed to 2 months of therapy and 8 shock treatments, the legal maximum. It didn't work. I was diagnosed with several different disorders, all of them serious. The prognosis was not good. As we couldn't resolve my problems, the doctor surmised that I had had a childhood trauma so powerful I could not bring it to the conscious memory. He said I would need to be on the medication for the rest of my life, and that I would need to return for shock treatments every 6 months or so indefinitely. And I was depressed before. I collected Gary from my best friend and returned to the cottage along with 6 medications, uppers, downers, muscle relaxants, and what someone called a chemical straitjacket. Yes, this was going to make me happy. I tried to return to a normal life so that my son would not be disturbed. I tried to keep busy, walked in the woods, spent afternoons at the beach, and thought of writing a book about my time in Hollywood, as a friend suggested. In Hollywood, ha ha ha. Nothing seemed to matter. After a week or two, I noticed an ad in a local newspaper, something like "Enlightened man wishing to start a group, students welcome." I called the number and I heard a lilting Scottish voice. I was invited over to meet Sydney Banks the next day for tea and met his lovely wife Barbara and 2 children, Susie and Dave. We had tea, and Sid told me about his recent experience in which he discovered the secret of life. He seemed so wise. I kept trying to tell him about my recent horrific experience, but he didn't seem interested. Sid would just say things like, "Oh, well, that's just the past," and "You'll be fine, dearie." But I need to talk about it. No, he wasn't interested. Yes, I was mesmerized. I had never in my life met anyone so what? So alive? So eloquent? His eyes shone with an unutterable light. His words seemed to come out of the sky. I had never heard anyone speak this way about life. After a couple of hours, he stood up and it was time for me to leave. At the door, he asked me to come again and said he planned on writing a book on his experience and revelations. I told him I planned to spend the coming winter writing a book about my experience. Good, he said. Then we'll write one together. The next day I was back and we began to write about what would become the Island of Knowledge. I had been the only one to respond to his ad, and apparently all those from his past life, coworkers, friends, and relatives, thought he was either high on drugs or had gone crazy. Barb, his sweet wife, told me that he had become such a wonderful husband and father that if this was crazy, she was all for it. Bill returned for a visit, and after hearing about Sid, he wanted to meet him. Soon Sid had two students sitting at his feet, listening to the wisdom which poured forth. We had both read Be Here Now and all the current spiritual books, but they were nothing like this. Everything changed. Bill came back to the island and began life as a carpenter. Within a week of meeting Sid, I took all 6 vials of medication and flushed them down the toilet. Never to this day have I taken any such meds. I did still try to bring up my visit to Hollywood, but Sid would just say, "That's all over now. You're fine." Modern psychology was lost, he said. All focus was on the past, as in my case, not on the ever important present, which is where we actually live. And live we did. Soon others came to join us. We finished the book and sold thousands of copies. Many students of Sid moved to the island to follow his teachings. Hearing about miracles, several psychologists also came. Sidney Banks sat before the fire in his cozy living room, looking out to the sea, his quiet time, and the world came to him. Lives were changed, hundreds, then thousands of them. I believe Sidney Banks shifted the way people perceived psychology and that there was a spiritual quality to life. May his words live on. Go ahead, Elaine.
Look what I have.
What?
Our next book, can you see it?
Oh, yeah.
Linda's book, one of her books, Encounters with an Enlightened Man.
Oh.
Oh, Okay,
Hold that picture up again. Hold the picture up because Mary's not seen Sid Banks as a young man. No, a little lower. A little lower. Yeah. Isn't he
Mhm.
cute?
And that's and this is Linda.
Oh,
Can
yeah.
you see her? Yeah.
Uh-huh.
Yeah. What a story. What a story. Linda Quiring and her husband Bill live on a small farm on Salt Spring Island, British Columbia, where they grow heritage apples and keep bees. Recently retired after 35 years making artisan soaps and body care products. Linda is the author of Island of Knowledge, Beyond Belief, The Lost Teachings of Sidney Banks, and Encounters with an Enlightened Man, the early years with Sidney Banks, and continues to write.
Mhm.
Wonder if she would do wouldn't it be great to have her on?
Yeah. I'm sure she'd
Yes.
come.
Yes.
I'm sure she'd come.
Yeah.
Well, I mean, why wouldn't you come and talk?
Right.
She's very
Yeah.
much in favor of Sid, so she probably would come on a call.
Yeah.
All right. So Elaine, you want to
Depression.
take the next chapter?
You got it. Depression. Toby Waltzer, UK. I grew up in a Chassidish Jewish neighborhood in London and had a very blessed life, a husband and 4 wonderful children. The depression really started at birth of my 5th child, my son Naphtali. Everything was quite normal, but as I held him, I immediately asked, "Are you mine?" The cord was still attached, and yet I was asking the midwife if he was mine. There was something a little strange about his look. He was a little floppy. I couldn't pinpoint it, but those were the words that came out of my mouth. "Are you mine?" I immediately thought I must sound like an idiot to the midwife, but that thought persisted for months. My previous babies had been so good-natured, but this new baby just screamed. It was non-stop screaming. The doctors thought it was reflux, so they put him on medication. I felt it was something else, but I couldn't tell the doctor that. I kept thinking the baby wasn't mine. They'll think I'm mad and that I need a doctor. I think looking back that my mind was protecting me from the realization that was something seriously wrong with this little boy. When he was 9 months old, we took him to a top private pediatrician on Harley Street who did all kinds of tests and said it might be hypotonia, where his muscle are a little weak, and physio will help that, or maybe a metabolic problem, and we can treat that. But I doubt it. Then, with a grave tone, said, or it may be something we just have to learn to live with forever. Now, my husband heard the first answers, but I heard the last one. We walked out of that office in two completely different realities. My husband left believing it would all be fixed soon, but I was shocked to the core. I knew there was something really wrong with my baby, and because my husband didn't offer to come with me for all the new tests and treatments, I thought he didn't care, and this caused a rift in our marriage for a while. From then on, I went into a severe depression. I couldn't eat, I couldn't sleep, and my mind went into overtime. My husband mentioned this to our doctor, who suggested I come in to see him. Now I wanted to shoot him and the doctor. Leave me alone. There is nothing wrong with me. There is something wrong with my baby. Eventually, I went, and the doctor put me on Prozac. I felt better briefly, but then I didn't. So he referred me to a psychiatrist. Life carried on, and I was very up and down. I put my heart and soul into getting my little boy to be normal. Sometimes I felt energetic. I loved this baby so much, but my mental health was suffering. 2 years later, I was pregnant again, and just before this next baby was born, someone close to me asked if I was concerned about this birth. I thought she was mad. I mean, did she think God was going to do this to me again? Yankee was born exactly 2 years after Nefertali, and I didn't pick anything at first, but there was a bit of a niggly feeling in the back of my mind. At the 6 weeks, I took him to the same pediatrician, and the doctor was very concerned. The tests came back saying that he was developmentally delayed, but we can't pinpoint anything, so we will have to wait and see. In the meantime, my depression got worse. The psychiatrist upped the medication and changed the medication and added more, so I was really up and down again. There were times when I was running all over the world to get the best treatment for these boys, and then other times when I would crash and be down for months, and that's how it was for the next few years. My mother then became ill quite suddenly with breast cancer and passed away 6 weeks later. It was very shocking to see, as she was my support and lifeline. My medications were increased, more therapy, but they really didn't help. From that time on, for the next few years, I went downhill continuously. Then my father passed away, and I crashed completely, and I could not get out of bed. The boys were now about 11 years old and had a diagnosis of developmentally delayed epilepsy and autism. I had hit rock bottom, spending 20 hours a day in bed. My husband had to deal with the kids as I couldn't do anything but sleep all day and all night. My psychiatrist decided I should have electroconvulsive treatment. He explained the risks, and I was actually going to go for it, even though I knew there would be some short-term memory loss. I was at my wit's end. Then I heard about the three principles through a Rebetson, who suggested I come to America to meet with Dr. George Pransky, but I couldn't even get out of bed. How was I going to get there? So she suggested that I go and see Terry Rubenstein in London, a wonderful three principles practitioner. I went to see Terry, and that's when my life changed. It was miraculous. I know it's not the way for everyone, but I heard it straight away, and it had an impact on me immediately. Terry told me a year later that when I first called, she was reluctant to meet with me because of the severity of my depression. She had debated and decided to give me one meeting, and thank God she did. I literally went in one person and came out a different person. I could not put my finger on it, and I could not tell you what she said, but she told me her story. She had recovered from an eating disorder and suicidal ideation, and I told her my story, and we spoke a little about thoughts that we are feeling or thinking, but it just got lighter. I guess I felt some hope that if she could get better, then so can I. I felt almost too good to be true. I went back a few days later and started to feel better and better and better. Within a few weeks, I was feeling better than I had ever felt in my life. Everything looked better, and I lived for 2 or 3 months in this very peaceful feeling. Life was just perfect. Everything was just perfect. Nothing in my life had changed. My kids were still autistic. My parents hadn't come back, but everything was different. I saw my therapist one more time, and she could tell there was something different about me. But the psychiatrist laughed at me. He poo-pooed the whole thing, and so my GP helped me come off of the 4 medications very slowly. I was on the last very small amount of medication, and I started to feel not brilliant. And because Terry was abroad, I went to go see Rabbi Shaul Rosenblatt, another 3 principles teacher in London, and he told me to be true to myself, that if I needed it, it was okay. So I stayed on a very low dose for a while longer. I think because I had been on it for 12 years, my body and brain really needed time to adjust. But eventually, I knew I didn't need it anymore. I am so grateful to God for pointing me in the direction. My boys are 27 and 29 now, and they are in supported living, just a 2-minute walk down the street from me, so I am with them all the time. They are very challenging and absolutely delightful, but even with the very challenging behaviors, I feel so blessed to have them. Also, my marriage improved drastically as I learned more about the 3 principles. I can still go through all the emotions, but I know I don't need to take it all so seriously, and that dissolves the feeling of whatever I have to deal with. It's okay, and it always passes. It's never the situation with my kids. It's where I am at the moment, and it's always okay, no matter what.
Well, isn't that a tearjerker?
Yes.
Yes.
Wow. I love that line. Yes, they are very challenging and absolutely delightful. And even with the very challenging behaviors, I feel so blessed to have them.
Yeah.
Yeah.
Also, her marriage improved drastically as I learned more about the 3 principles, she says. I can still go through all the emotions, but I know I don't need to take it all so seriously. And that dissolves the feeling of whatever I have to deal with. It's okay, and it always passes. It's never the situation with my kids. It's where I am at this moment, and it's always okay, no matter what. Woo!
Yeah. You know, it reminds me this morning, I have 2 sisters left. I had 3 to begin with, and one sister's passed away, but the other 2 sisters, one of them's legally blind and lives in Beverly, Massachusetts, and the other is 2 years older than her, and she lives in an assisted living in Virginia. And the sister that lives in Virginia has a long history of depression and anxiety, that she's a very strong religious woman and did not want medications. And but neither did she have any willingness for self-reflection or education. So she would it was hard to be around her a lot. She'd get panicky, and she'd call the emergency room, and you know, she just was all over the place and tough. But as she's gotten older, her she's I don't know that I would say she's got dementia, but she's, you know, got 84-year-old woman's not everything's firing. And a couple of years ago, the nurse practitioner that belongs to the place suggested she go on antidepressant because she was depressed, and so she'd always refused up until then. But then it got to the point where they'd give her medication. She'd say, "What's in here?" They go, "Oh, the ones you're supposed to be on." Okay, and she'd dump them in. So she has gotten a lot better, I got to tell you. Her cortisol levels are down, right? So now, but the other interesting thing is the sister that's blind flew down last night to Virginia and got picked up by our niece and is visiting her older sister, our older sister. They haven't seen each other for about 4 years. And I got we had a nice conversation today and a nice chat. And it's very my niece took a video of these 2 old ladies, my dear sisters, hugging, and oh, you know, and my sister that's older and less mentally available, was weeping and crying. Oh, I'm so glad to see you. I'm so glad. And she's always been a tearful, weepy, emotional lady. And so she was crying, and then and my other sister was crying a little bit too, and they pulled apart. And the other sister goes, "Oh, it's so hot in here." And so the sister that lives there, she just went, "Oh, we'll put on the air conditioning." Her mood went from, "Oh, my sister I haven't seen in years. Oh, I missed you. I love you," to practical, like, "Oh, put on the air conditioning." What I'm noticing about her getting older is she feels her feelings in the moment and they go. It's like classic three principles understanding of how the mind works.
Yeah.
I see you. I love you. I'm overcome with emotion. Oh, it's hot in here. Put on the air conditioning. You want to go out for lunch? I think I'd like to go, like just move it along. Whereas in older times, former days, she would, she would just boo-hoo and blubber and, "I can't believe you made the trip from Massachusetts and you're so wonderful." And, and it would take a while for people to go, "All right, it's okay," but now, because of her dementia or whatever you want to call it, she just does life moment to moment.
He's in the
Like,
flow.
in the flow. And last week, my sister said, "I'm going to come see you next Wednesday." And she goes, "Really? You're going to come all this way? I'm so excited." And then 2 days later, they're on the phone. And Martha goes, "Next Wednesday." And Kathy goes, "What's going to happen next Wednesday?" She goes, "I'm coming to visit you." "You are?" Yes. So, you know what I mean? It's just like minute to
Yeah.
minute. And she's just so much happier.
Mhm.
And she could have been doing that,
No,
right? She had
that's,
her midlife and her older years were fairly miserable. I mean, not generally miserable, but she had so many miserable moments, panicking and worrying and scared and thinking about this, what's going to happen, and why didn't that happen? And as opposed to just living in the
Oh.
moment and feeling the feels and moving on.
Yeah,
Yeah,
Yeah.
fascinating.
beautiful, great story.
Yeah,
Great story, Wendy. Yeah.
yeah,
Yeah.
I love when we have our personal stories that illustrate what we just read, isn't it?
yeah, yeah. I was really appreciating that this morning and seeing the video. Like I said, she's really boo-hooing, and then they separate. And the other sister who just got to Virginia goes, "It's hot in here." She goes, "Oh, we'll just put on the air conditioner." It's like,
Is
okay,
it safe to say that when Sid said that we are coming home, this is part of it? Is that we get to this point that we're coming home?
yep, yep, yep. Coming home to, the definition of mental health that he said is contentment. I'm
Yes.
content.
Yes.
And the further discontented we are, the further we are away from mental health. Like in Rani Bora, she talked
Mhm.
about they exhibited signs of mental unwell, whatever the right word is, mental
Yes.
health problems. And I was thinking, what are those now that she's a three-print? But it's sort of like, I can't eat, I'm fidgeting, I'm unable to, go to my job, I can't sleep or whatever. So that's mental unwellness. You're not content, It's interesting.
Yeah. Yes. And on that note, I've got to go.
Okay,
All
bye.
right.
Okay.
Bye, guys.
Have a
good
great
one.
session, Elaine.
Yeah.
See you
Yes,
next
Bye-bye.
definitely.
Tuesday.
See you next
Thank you,
week.
everybody.
Bye.
Well,
Bye.
I'm gonna
Mary, you
stop
can
the
stay